Hello, beautiful people. Thank you very much for clicking on this video. Dr. Pen here present. Today, I'm going to be sharing with you something very, very important that is going to help you, that is going to help your friends, your family members, your loved ones. Maybe you are a person that you are planning to get married and you have children, or you have been looking for children. Today, I'm going to be sharing something that is going to help you. I'm going to be delivering a vital information here that is going to help you. So today, I'm going to be talking on hormonal imbalance in women. Hormonal imbalance in women. The woman reproductive system is being controlled by a series of hormones, a number of hormones. So before a woman conceives, there are a lot of hormones that comes into play to arrange everything in her to before she can conceive. But today, a lot of women suffer from what we call hormonal imbalance. They suffer a lot from what we call hormonal imbalance, and that's the reason they cannot conceive. They cannot have children on their own, or they cannot give their husband babies. And what causes hormonal imbalance in women? The first thing is infections. Infections causes hormonal imbalance in women. There are a lot of women that cannot conceive. When they get to the hospital for checkup, for diagnosis, for consultation, they will let them understand that they have an infection and they provide drugs for them to go and take in order to kill the infection that is responsible for their infertility. And there is a vital part of it. These infections, sometimes when you go and take the treatment, yet you don't have children. Sometimes it is because these infections have distorted your hormones. Your hormones are not functioning normal. They are not in their normal quantity. Either this infection has lead to low hormones or higher hormones. They have made your hormones to become higher than the normal value, or the lower than the normal value. So they have distorted your hormones. So another thing that you need to do is to run a hormonal test after after taking the treatment and there is no solution. You run a hormonal test. The second thing that causes hormonal imbalance is what we call PCOS. PCOS. PCOS stands for polycystic ovarian syndrome. Polycystic ovarian syndrome. There are women that when they are, because of infertility, because of the fact that they cannot conceive a baby on their own, they will visit the hospital. After they visit the hospital, they will carry out an echography and they will write on it that you have what we call a multiple ovarian cyst. Multiple ovarian cyst. That is what we refer to as polycystic ovarian syndrome. When you have multiple ovarian cyst, that means you have small growth around your ovary filled with liquid. That is what we refer to as polycystic ovarian syndrome. And this can result to hormonal imbalance. This can also result to hormonal imbalance and lead to infertility. And so when you are in the hospital for the problem of fertility problems, and the signal that you have uh, ovarian cyst, multiple ovarian cyst, it is very important. Even if the doctor don't signal to you that you should run for your own good, it's good to tell the doctor that I need to run hormonal test. Need to run hormonal test because some of these cysts, they result to what we call hormonal imbalance. And when the hormones are not balanced, they cause what we call infertility. They cause what we call infertility. And another thing that causes hormonal imbalance is what we call fibroid. Fibroid. When women are not fertile, when women, because of problems of infertility, and they go to the hospital, you will see after echography, after examining, they will let you understand that you have a fibroid. fibroid in your uterus. You have a fibroid in your uterus. Sometimes the doctors will let you understand the fibroid is not in a position that can disturb conception. But the presence of these fibroids can lead to what we call hormonal imbalance. That is why if you are looking for a child, you cannot conceive because of fibroid, it is good that you run what we call a hormonal test. A hormonal test in order to be assured that this fibroid I have has not distorted my hormones. And that is why, maybe why I cannot conceive. And so it is very, very important hormonal test. So another thing is fibroid. Fibroid also lead to hormonal imbalance. The fourth thing is what we call contraceptives. Contraceptives. This point is very, very vital. Contraceptives. You know, a lot of young girls today has engaged themselves into contraceptives. Either they are taking these contraceptive pills, especially contraceptive pills. You know, when I talk about contraceptives, there are these means that there are these means, there are means they are like taking drugs to prevent pregnancy. That means family, like family planning, what they call family planning. You are taking something to prevent unwanted pregnancy. Since young ladies of nowadays, they engage in sexual activities very early, and you will see a very young girl of 18 years, and he will telling you that he's on contraceptives. Wow, can you imagine that? It's as if you are just like destroying your future with the knowing, because sometimes taking contraceptives, you may never give birth at all because they will go and distort your hormonal, your hormones. They will distort your hormones, and you are taking contraceptive as early as this. It's not good. So there are young ladies today that when they engage in sexual activities, since they know that they can have sex and take a 24 hours pill or a 48 hours pill, they jump into it. They take pills every time, every time, every time, every time. And this is one of the cause of hormonal imbalance in women, and it result to you not having a child sometimes. And so that contraceptives also lead to hormonal imbalance, which can cause infertility. The third, another thing is what we call the ovarian cyst. The ovarian cyst is just like the multiple ovarian cysts I've just talked about. Ovarian cyst, a growth at the level of the ovary that sometimes is filled with liquid in it, and it provoke what we call hormonal imbalance also. And the last thing, sometimes the last thing is stress. Stress sometimes also lead to hormonal imbalance, and that is why it is not good to be stressed. A woman that is looking for a child and is stressed, you need to be very, very happy when looking for a child. You need to be at your normal mood, nothing to stress you. As when the stress keep coming, when you are stressed while you are looking for a child, most of the time it causes hormonal imbalance. And that is why sometimes when you see women that have been eagerly looking for children, they are very stressed and they are not more happy because they are mentally unstable. They want the child by all means, and they develop a lot of stress. I want to let you understand that instead of developing that stress, you should find something that will make you happy, because as more you develop the stress, the more you instead causes what we call hormonal imbalance, and it will be very difficult for you to conceive. And so, how can one knows that he is suffering from hormonal imbalance? So, what are the symptoms that would tell somebody that you are suffering from hormonal imbalance? The first thing is that you will have what we call irregular menses. Irregular menses. You will discover irregular menstruation. You will discover that you can see your period this month or 21 days. After 10 days you see your period, it is just in disorder. And sometimes your period may be different with 5 days, 6 days. You can 5 days before the normal day, 8 days before the normal day, or 5 days after the normal day, 2 3 days. That means the period you do not have a regular cycle. Your menstruation is irregular. It comes after you have a period that it fluctuates. Sometimes it comes early, sometimes it high. That is a sign that you suffer from hormonal imbalance. And at sometimes there are people that their period for a whole month, they don't even see their period. They don't see their period for the whole month. That is also a sign that you suffer from hormonal imbalance, because it is abnormal for a woman to miss even a single month without seeing her period. It is very, very abnormal. So the symptoms that you suffer from hormonal imbalance is irregular menses and absence of your menses. That tells you that you suffer from hormonal imbalance. So what do you have to do? You need to run to the hospital so that they can run you a hormonal test, what we call hormonal assay or hormonal profile. It's either you visit the laboratory technician directly to run your hormonal assay test or hormonal profile. But the best way, the normal way, is to visit the hospital or call for your doctor to consult you. If your doctor consult you and did not arrive at the point of prescribing you hormonal test, you should also inform your doctor that, doctor, it was good for me. You proposed that it was good for me to run a hormonal test. So that is what you should do. You run and do a hormonal test. When I talk about a hormonal profile, we have five basic hormones. Five basic hormones that are very, very important as far as the woman reproduction is concerned. That plays a greater role in the woman's reproductive system. We have five hormones. We have the follicle stimulating hormone, we have the luteinizing hormone, we have prolactin, we have estrogen, we have progesterone. These are the five hormones. These five hormones are very, very important. So when you are suffering from infertility, if you cannot conceive a child, don't just go ahead buying hormonal drugs to take, because hormones, it is a series of hormones. It's not a single hormone. So you may go and buy an hormone that is progesterone. Meanwhile, you suffer from insufficient follicle stimulating hormone. So you may go and buy a hormone that it is not that hormone that is responsible for your problem. Instead, you buy a different hormone and you are instead creating more problem. So the best way to handle the issue is that it is always good to visit the hospital so that they can run your test and so that you can be sure of which hormone you should take. It should be certain that this problem is due to this hormone, and the hormone should be prescribed to you for you to take that very hormone. And so when you are running a hormonal test, it is very, very important to follow up the rules and regulations to run that test. It's very, very important. Very important, because it is a hormone. These hormones, they appear at different periods of your menstrual cycle. And so measuring them will need you to respect the time very well. And because if you don't respect the time, sometimes you may have a false result. And so when you are suffering from hormonal imbalance, if you want to do what we call hormonal profile, you need to first of all master when you are menstruating. There are four hormones that you have to run on the second or third day of your cycle, on the second or third day of your menstrual cycle. When I say the second or third day, when you start menstruating today, that is one. Then the second day and the third day. That means the first day is the day that you start seeing blood coming out of your vagina. That is the first day. So this on the second day or the third day, that is when you start the running the test. you are going to run four hormones, a test. You first of all carry out a test for four hormones. That is, you have the follicle stimulating hormone, the luteinizing hormone, prolactin, and estrogen. These are the four that they carry on the second or the third day of your menstruation. And then you will wait until the 21st day, of your menstruation, before they will carry out the last test, which is progesterone. So respecting this procedure is very, very vital, because at different periods of your cycle, these hormones changes. These hormones changing. Carrying out the progesterone test around the 21st of your cycle is because progesterone is a hormone that controls your ovulation. So after your ovulation day, it is that 7 days to that period, the 21st day. So progesterone is a hormone that controls your ovulation. And so you see at different periods of your cycle, these hormones, they keep changing. And so that was the information that I wanted to pass out to you. Thank you. I hope that this information helps you. It helps your loved ones. It helps the ones that you care for. And please, you share so that many people can also benefit from this information, because a lot of people suffer from what we call hormonal imbalance, and it gives them headache. There are couples that do not have a child just because of this hormonal imbalance. And if you are around Cameroon, Bafusam, you can get to me by clicking on the link that on this video, so that we can do the things together. If you are in need of a baby and you see into it that it may be due to hormonal problem, you can click on the link below so that we can do it together. Thank you very much for your kind attention, and see you.